This is a public safety announcement. The United States is right now in a pandemic due to the virus called COVID-19. The virus originated in China, the Hubei province, near or in the capital city of Wuhan. As reported by the Wuhan Municipal Health, the first case happened in December 2019. Since COVID-19 shows symptoms of pneumonia that can be shown as deadly, people that are more susceptible are those that have underlying health conditions concerning their lungs like asthma, the elderly, and those who smoke and vape. The virus is thought to spread mostly between people that are within 6 feet of one another. The form that is spread is in through the respiratory droplets produced when an infected person coughs, sneezes, or even talks. It has been researched that the virus has a potential to spread by people who are not even showing these symptoms at all. There are many ways to help slow down the spread of the coronavirus, as it has been called as well. We all need to do our parts so that it can have the greatest effects so that we can slow it down. Washing your hands frequently is the most common way. It is recommended that you at least wash your hands for at least 20 seconds and make sure to wash them properly, like this. Wash the fronts, wash the backs, wash under the nails, and between the fingers. And if there's not a place to wash your hands, try to use at least hand sanitizer that has at least 60% alcohol. Also, try not to touch your nose, mouth, or eyes with unwashed hands. Social distancing is also another way to help decrease the chances of spreading the virus. 6 feet is recommended distance to keep between others outside of your household or even people inside your household if they are sick. This is especially helpful for those who have a higher risk of getting very sick due to COVID-19. Using a face covering is another recommendation to help slow the spread. Anyone that is spreading the virus doesn't even have to feel sick. A cloth face covering is recommended when going out to public, like grocery stores or anything that could be deemed as essential that you need. A cloth face mask is meant to prevent you from spreading the virus just in case you are infected and don't show any symptoms. It is also asked that people do not use medical face masks like the N95 so that it can be safe for medical workers who actually need them to perform their job properly and safely. For sneezing purposes, if you do not wear a face covering, you are to cover your nose and your mouth with a tissue and discard immediately, or use the inside of your elbow. But then immediately afterwards, it is recommended that you wash your hands for at least another 20 seconds or use hand sanitizer with 60% alcohol concentrate in it. Cleaning and disinfecting commonly touched areas on a daily basis or even multiple times in a day is another way to help combat the virus. Commonly touched places like tables, handles, light switches, phones, keyboards, toilets, and sinks are all commonly touched areas in publics. The last and most important way to help is by monitoring your own health. By knowing the symptoms of COVID, like fever, cough, shortness of breath, can help you understand if you potentially could have it, which then will also help slow the spread if you help self-quarantine for at least 14 days. But when checking your temperature for a fever, don't check your temperature within 30 minutes of exercising or taking medication that it is known to help lower fevers and temperatures, which can cause you to have false readings. If we can all do our parts and follow these recommendations, we can help slow down the spread of COVID-19 and potentially save the lives of those around us and those that we hold dear. And this was your public safety announcement.